So from your book, I read that, and this is, I sort of want to bring this whole oxygen thing to the brain or to the tissues, to the viewers. By the time you're 40 years old, in a perfect world, you've lost 50% capability of your nitric oxide production. Yes?
That's right, by the endothelium. Yeah.
By the endothelium.
In terms of general kind of population-based studies, that seems to be the case.
So we got 50% at 40, and what I want the viewers to imagine stripping 50% of the oxygen in the room that you're sitting in right now. How would that feel? I don't know if many of you have gone to high elevation. I mean, just walking up a flight of stairs is exhausting. And that's pretty much what our cells are feeling, that, you know, we're losing that oxygen and nutrient delivery to every single organ and tissue in your body.
Yeah, and I think you make a very good point there, and perhaps a point we overlook. So nitric oxide is not just a vasodilator.
Correct.
Yes.
In a paper published in 2015, which I think is one of the most remarkable discoveries in the nitric oxide field in the past 30 years, is that nitric oxide is required for oxygen uptake and oxygen delivery by red blood cells.
Wow.
So without nitric oxide being produced, you don't get oxygen delivered to individual cells.